Med history. In the early 1900s, a mania for miraculous radioactive therapy was spreading in the United States. The magazines were filled with tempting headlines. All life processes are improved thanks to radium radiation therapy. Radioactivity is capable of anything. As a result, a real frenzy began. Toothpastes with radium, face creams, food. Everything where radium could be used began to fill store shelves and quickly scattered among enthusiastic consumers. By the time Eben consumed 1,400 vials of the drug radiator, most of his skull had already been destroyed by radiation, which was the main component of this magical remedy. All the activity around radium can be traced back to 1903, when physicist D. Thomson studied wells, the water from which has been considered healing for centuries. The scientists discovered that the special power of this water lies in an inert radioactive gas, radon. According to the researchers, radiation filled the human body with vital energy, promoted cellular activity, and accelerated metabolism. It was a great startup for a young chemist, wasn't it? The only problem was how to keep radium in the vials, as it instantly disintegrated upon contact with air. But there is no problem that inventive Americans cannot solve. Already in 1912, enterprising entrepreneurs patented the first device called the Revigator, which allowed the owner to charge water with radium right at home. This eternal source of health at your home was a vessel containing radium, into which water was poured. During the night, the water was charged with useful properties. Thus, it was possible to start every morning not with a cup of coffee, but with a glass of healing water, which, according to the statement, could prevent diseases, slow down the aging process, and fill life with youth joy. One of the unfortunate victims of this dangerous invention was poor Eben Byers. The radiator was patented by William D.A. Bailey, a failed Harvard student who was expelled from the university, but still self-styled himself as a doctor. Despite the fact that all his previous medicines had no real effectiveness, they were at least not deadly, unlike the radiator. This preparation was ordinary distilled water infused with an isotope of radium. Bailey claimed that his invention was able to cure any disease by stimulating the endocrine system. To attract more patients, he offered doctors a 17% commission for each appointment of a radiator to his patients. Byers got his first dose of this drug and felt really better. Gradually, he increased the dose, reaching 3 bottles of the drug per day. When Byers realized in 1930 that the drug did not cure but destroyed his body, it was already too late. His bones were affected by cancer, and his jaw was almost completely destroyed. Byers went through 2 surgeries, as a result of which he had to lose his upper jaw, with the exception of 2 front teeth, as well as most of his lower jaw. The terrible story of Eben Byers caused a shock in American society. The newspapers reported that the radium water worked fine until his jaw dropped. The sale of radioactive drugs was immediately banned, and radium itself was recognized as a deadly substance. Bailey's firm was shut down, but the deceiver was not discouraged. Soon he created a new company that was engaged in the production of radioactive wallets, belt buckles, and devices for charging water with radium. The unfortunate victim of his inventions found peace in the Allegheny Cemetery in Pittsburgh. Byers' body was placed in a lead coffin to contain the radiation coming from it. Strangely enough, after the incident with Byers, the sale of radium products continued. In the early 1980s, a cigarette filter with a radioactive mouthpiece could be purchased in the United States. The manufacturer claimed that the amazing effectiveness of radium radiation protects your health from harmful substances contained in cigarettes and makes the taste of cigarettes softer and more pleasant. However, over time, serious scientific work has been carried out, which has shown that radium and other radioactive substances are really dangerous to human health. This led to a gradual ban on their use in industry and medicine. Today, the story of Eben Byers reminds us how important it is to be vigilant and critically evaluate advertising promises about the amazing properties of various products. It also reminds of the need for strict state control in the field of food and drug safety. Radiation sickness occurs as a result of a single exposure to high intensity or prolonged exposure to low doses of radiation. Short-term severe damage occurs in man-made disasters at nuclear power plants, tests, or the use of nuclear weapons, as well as in the treatment of cancer and blood diseases. Chronic disease can be occupational. It develops in medical workers of radiology and therapy departments. In addition, it can develop in patients who often undergo X-ray and radioisotope examinations. Experts identify a number of factors that cause the chronic course of radiation sickness, HLB. Wave radiation, X-rays and gamma radiation, with a wavelength comparable to cellular structures, causing deep damage to all tissues in the area of its impact. Gamma radiation is high-energy particles that penetrate deep into tissues and organs and massively destroy them. It is this type of radiation that is most dangerous in a nuclear explosion. A layer of lead can temporarily delay the negative effect of gamma radiation on the body. Streams of charged particles with high energy, beta radiation, protons, neutrons, and alpha particles. Alpha particles are dangerous when ingested with food or water, but they cannot penetrate from the outside through the skin. Beta particles are high-energy electrons that can penetrate to a depth of up to 2 centimeters. They are less dangerous than alpha particles, but due to their greater penetrating power, they destroy the upper layer of the skin and subcutaneous tissue, which leads to serious burns. Beta particles cause tissue damage directly in the areas of the body adjacent to the radioactive source. Diagnosis of radiation sickness. The difficulty in diagnosing early symptoms of CLB arises due to the lack of a specific clinical picture, characteristic only for this disease. In order to correctly diagnose the disease, the following indicators must be taken into account: the initial state of human health before possible exposure, data on working conditions, everyday life and incidence of infectious diseases during the period of work with radiators, the degree of radiation exposure in the course of industrial activity, radiation dose, radiometry data of the patient and his secretions, clinical manifestations of the disease that occurred during contact with the emitters. The following analyses are recommended: a general blood test with an expanded leukocyte formula and the rate of erythrocyte sedimentation, somatic long-term effects of radiation exposure, shortening life expectancy, malignant neoplasms, cataract seals and atrophy of the skin, connective tissue, blood vessels, kidneys, and lungs, loss of elasticity and other morphofunctional disorders leading to fibrosis and sclerosis, genetic long-term effects of radiation exposure. Hereditary diseases and the offspring of irradiated parents are divided into somatic and genetic consequences conditionally. The genetic apparatus of both somatic and germ cells is damaged. Damage can be inherited within the tissues of a given organism, somatic mutagenesis, or in the offspring of irradiated individuals, genetic mutations, radiobiological effects. Deterministic, have a clear dose threshold of manifestation. Stochastic, do not have a clear dose threshold for manifestation. The frequency of manifestation increases with increasing radiation dose, for example, carcinogenesis.